open it up. Good evening, everyone. Welcome. We'll just give it a minute for folks to join. Welcome, everyone. We're so glad that you could make it this evening. We'll get started here in a few minutes. Okay, it is a minute after 6, so let's go ahead and get started. Just confirming that we're recording. So I want to first welcome folks to tonight's webinar. Before I introduce myself and kick us off, I'd like to share how attendees can use closed captions and can listen in Spanish. So tonight's webinar does allow for closed captioning. In order to turn on subtitles, please look for the button at the bottom of your screen labeled CC. It's shown in the example on the screen, and press it. Next slide. Tonight's webinar can also be heard in Spanish. If you'd like to listen to tonight's webinar in Spanish, there is a button labeled Interpretation on the Zoom screen. Just go ahead and click that button and select Spanish to hear the meeting in Spanish. I'll now let our Spanish interpreter provide those instructions in Spanish.
Hola, ¿qué tal? Buenas noches a todos y a todas. Para este webinario está disponible la interpretación simultánea hacia el español. En caso de que quiera escuchar el webinario en español, hay un botón en la parte inferior de la barra de Zoom que dice Interpretación, o también en donde dice Más, en los 3 puntos. Si le dan clic ahí, van a encontrar la selección de canales y la selección de idiomas para escuchar en español.
Thank you. All right, welcome everyone. I'm Courtney Smith. I'm the Principal Deputy Executive Officer at the California Air Resources Board. I am so glad you could join us tonight for this important webinar, where we really hope to provide information to help you better understand air quality and associated health impacts in the wake of the Los Angeles wildfires. First, I just want to share that we recognize that this unprecedented disaster and the subsequent recovery efforts have raised many concerns, only one of which is concern regarding air quality impacts and what that means for people's health. You know, not only for those wanting to return to the area, but also communities that may be near or impacted by recovery activities. We also really appreciate many may be feeling overwhelmed, including with the volume of information. And we're sensitive to this being yet another webinar, but we wanted to balance that with ensuring folks have transparency into what we know about air quality impacts, what we don't know, and to make sure folks have the information they need to help protect themselves and their families. So tonight, we are joined by colleagues from the US EPA Region 9, from Army Corps of Engineers, both of whom will help provide an overview of Phase 1 and Phase 2 cleanup activities. Following that, we're going to hear from folks from South Coast Air Quality Management District, who are going to provide an overview of what air quality concerns fires present, but then also to share their expanded air quality monitoring that they're undertaking to help us all better understand the broader air quality impacts, including those that may arise from the hazardous waste and toxic debris left behind. Then we'll hear from Dr. John Balmes, associated with UCSF and UC Berkeley, as well as Dr. Cyrus Rangan from the California Department of Public Health on what we know about health impacts of wildfire smoke and ash. We'll then hear from colleagues at the California Air Resources Board who want to share protective measures you and your families can take to minimize risk of exposure. And then lastly, we're going to provide additional resources on information and tools for you to learn more. You know, these past weeks, we've been working very closely with these local, state, and federal partners that have joined us tonight, often talking multiple times a day. So I really want to thank them for coming together tonight for this important event and for the ongoing coordination as we work to just better understand how the LA wildfires present air quality concerns and to try to communicate that information to you all so everyone can make the best decisions possible with what we know. So tonight's webinar will be recorded, and it will be made available on the California Air Resources Board's YouTube channel. And we aim to post that tomorrow. We'll also be making the slides available. We have a lot of information we want to make sure you get tonight. So we will not have time to answer questions during the webinar, but we have an email address that you can send all of your questions to, and we'll work with our colleagues here to answer them as soon as we can. That email is lafiresairquality@arb.ca.gov. We'll providing this to you again later this evening. Just wanted to, at the top, let you know we welcome your questions. With that, I am pleased to introduce Harry Allen. He's the on-scene coordinator of the Emergency Response Section of the US EPA Region 9. Let's go to the next slide. Next one. Harry.
Thank you, Courtney, and thanks to everyone for joining tonight. As was mentioned, I'm an on-scene coordinator for the U.S. Environmental Protection Agency, which means my standard business is going to hazardous materials, accidents, contaminated sites, and other types of natural disasters. And we pulled together a team of on-scene coordinators and EPA expertise from around the country to address this devastating fire situation here in Los Angeles. I also happen to be a local resident from the city of South Pasadena, and I realized that the air and the air quality and smoke affects all of us. And just to talk a little bit about how we believe debris removal is going to hopefully make a difference in removing a majority of the sources of air pollution from going forward, noting that that's not the only source of air pollution here, and we have a long way to go for recovery. But debris recovery, as described by the Federal Emergency Management Agency's mission assignments, is divided into two phases we call phase 1 and 2. Phase 2 is the removal of bulk soil, ash, and debris. We use heavy equipment to do that. It's led by the U.S. Army Corps of Engineers, and you're going to hear more about that in a second. We do phase 1 at the US EPA, and that is aimed at removing hazardous materials that may harm workers as they move debris, whether they be public government workers or private contractors. And we also want to make sure those materials don't cause problems in transit or go into the wrong disposal facility. So we're working hard to remove things such as electronic waste, burnt paint cans, other burnt chemicals that may not have completely combusted, could still pose a hazard or leak. We're removing lots of different types of batteries, car batteries, especially lithium-ion batteries. And we do that from parcel to parcel. We have about 13,500 parcels to clear. Next slide, please. As you can see, we do the work by hand. It's all done by hand in phase 1, so that we can avoid accidents, minimize dust, and we do worker monitoring. So if you see the picture on the left, our teams each have hazardous materials specialists who can do air monitoring at the site for the worker safety. And this has the added benefit of turning what's an unknown situation, a classic hazardous materials situation, into something we know a little bit more about. In other words, if we walk through a site with a radiation meter as depicted there, we can assure that in the future there aren't any radioactive sources on the property. We have a gas meter there, that tiny yellow instrument in the hand of that worker. That's an instrument that looks for explosive atmospheres. It looks for volatile chemicals. And we're able to declare these sites safe for our work to continue. And so on the right, you've got a team picking up household hazardous materials, different kinds of cylinders. Propane is common, acetylene in some cases that may not have combusted and completely vented. We go through that and remove those materials so that, again, phase 2 can occur. So when we mark a site complete, it doesn't look like we did much, but you can be assured that we went through and tried to find the most dangerous goods and brought those out. We double bag these dangerous containers We put them in two double plastic lined bag, goes onto our truck, and then it goes off to one of our 5 staging areas between the 2 fire footprints. We have 5 staging areas. And what's notable is that at those staging areas, we have air monitoring 24/7 to ensure that our workers are protected in those sites. They're analogous to the monitors in the picture on the left. Next slide, please. So just a little overhead of what we're picking up and how that looks. You'll see our crews out. We've got well over 40 crews in each footprint, and they have about 6 to 8 members on each crew. And you can see the type of materials we're collecting, bagging, taking to the staging areas. And just to give a level of comfort again for future entrants and for workers coming back to remove the debris. Next slide, please. We've got a live map that shows not only where we're working, but what our progress is. And in this particular window of our live map, which is public facing, you can actually look up the status of the parcel. Not only can you look at our operation overall and our progress, but you can look up the status of an individual parcel, which I think is useful. I wanted to mention, we do this work in close participation and partnership with the California EPA Department of Toxic Substances Control. They've also fielded teams and work alongside of us. We've got also members of the LA County Fire, Health and Hazardous Materials Division working side by side. And we work closely with the Army Corps of Engineers. Mr. Koger is going to be speaking next to do this work. They also have an air monitoring project that they're going to be discussing. So we're going to work through this debris recovery as fast as possible, again, to try to remove the bulk of the lingering contamination in the area. And we realize that's not the whole, the whole problem. There's ash and dust all over Los Angeles as a result of these fires. And so that's why we're supporting our state and local colleagues, especially with the South Coast Air Quality Management District, which you'll hear from tonight, and the California Air Resources Board, and trying to enable them to provide their air expertise to this situation and really try to address the concerns of us as Angelenos and monitor the situation and report findings. So you can try that QR code to track our status. You can see where we're working tomorrow. And again, you can see the individual progress parcel to parcel. And rest assured, we're working as hard as we can, as fast as we can, and as safe as we can to take care of our part of the debris recovery. Thank you very much.
Great. Thanks so much, Harry. Before we go to Dr. Koger, I just want to direct folks to our webinar chat. You may have noticed we are providing the resources that are mentioned in real time to you as we're going through. So take a look at the chat for the links to the different resources that we're featuring. Next, I'm very looking forward to introducing Dr. Corey Koger. He's the debris subject matter expert with the U.S. Army Corps of Engineers, who's going to talk to us about phase 2 debris removal. Dr. Koger.
Good evening. I'm glad that we can have this discussion and hopefully lay some fears to rest about how this work is going to progress. As Harry was saying, or Mr. Allen was saying, we work closely with the EPA. Actually, we work closely with Air Quality Management District and the Air Resources Board. We're members of the Air Monitoring and Air Quality team. But I wanted to give you a little bit of an overview of what the phase 2 debris removal would look like, and then how we're going to do protection while we do that for air quality. First and foremost, safety of the community and our crews is essential. As we do debris removal work and we're loading ash and debris into trucks, those trucks will be lined with plastic. And under wet methods, as we're spraying, each of those loads is wetted and placed into a truck to keep dust and ash down. All the while, we're doing monitoring for worker safety. So each of the persons that enters that debris zone, we'll have air monitoring equipment, and we monitor worker safety that way. And immediately at the perimeter of each of the sites, we will have a real-time air monitor to show that as we wet that, it's keeping that dust down, so it's not getting off the property. And finally, we'll have a third tier of air monitoring, and that's the nearest downwind sensitive receptor. And that might be a resident that's still living in a home that's adjacent to a burned property, or a daycare center, a school, or maybe a hospital, for example. All the while that real-time air monitoring is collecting information, and it has an alarm. And if that alarm goes off, then we need to adjust our air monitor, our what methods or engineering controls. And in that way, we can provide a level of assurance that we're not causing an air quality problem. And as I said, after that ash and debris is loaded into trucks, it is encapsulated. Then we put a tarp over that, and that is hauled directly to a landfill. There's no off-site staging of that material, and then that's placed in a landfill. And really, that's to keep dust and ash within the truck at all times, so that we don't have any issues in the community. And that's pretty much an overview of our information. We are going to be providing our air quality monitoring data to an appropriate agency. I think we're still working through that, who's going to host that, and how that's going to be pushed out to the public, but we're again willing to share our data. And with that, that's the end of my presentation.
Great. Thank you so much, Dr. Koger. All right, I would like to introduce Dr. Scott Epstein. He's the Planning and Rules Manager at the South Coast Air Quality Management District. Him and his colleague, Dr. Jason Lowe, are going to walk us through an overview of air quality concerns and the expanded monitoring that South Coast is leading in the area. Dr. Epstein.
Thanks for the introduction. I'm happy to be here. Next slide, please. Okay, so first I want to talk a bit about the air quality index. So basically, air pollutants can come in many forms in the atmosphere. There's countless different air pollutants in the atmosphere. They can either be solid, liquids, or gases. So we monitor regularly a whole wide variety of air pollutants. Some of them are what we call the criteria pollutants. So these are pollutants that are pervasive in the urban atmosphere and also have federal air quality standards. So I've listed 5 of them on the left that we use in our air quality index map. So the bottom 3 are gaseous pollutants. So ozone, which is the key ingredient in smog, carbon monoxide, and nitrogen dioxide. We also monitor particle pollutants. So this is when pollutants appear as either solids or liquids in the atmosphere. They show up as particles, so these microscopic droplets. So the smallest particles in the atmosphere are what we call PM 2.5 that we routinely measure. And those are particles that are less than 2.5 microns in diameter. So that a micron is a millionth of a meter. And we also measure PM 10. So those are particles less than 10 micron in diameter. So those measurements are actually the total mixture of those particles. So the gases, ozone, carbon monoxide, and nitrogen dioxide are specific chemicals. However, PM 2.5 and PM 10 are mixtures. So we're measuring the total mass of those particles in the atmosphere. So there's quite a bit of health effects research out there. Giving people the total amount of mass in the atmosphere is not particularly useful without some context, some health context. So there are national ambient air quality standards that incorporate all this health effects research to figure out how concerned we should be at a given level of each of these pollutants. So with these air quality standards and this health effects research, we can convert concentration, what's measured into the atmosphere, into an air quality index. An air quality index, I'm sure you've seen, various levels: green, good; yellow, moderate; orange, unhealthy for sensitive groups, and so on. And depending on the air quality index level, there are different precautions that are recommended, also depending on your particular situation. So we display that air quality index on the South Coast AQMD mobile app for our region, also at aqmd.gov. And there are other versions of the air quality index using similar methods throughout the internet, including airnow.gov. Next slide, please. Okay, so now let's think about what pollutants we are particularly concerned about when it comes to fires, and look at that in the context of AQI. So there are solid and liquid air toxics that do form in the presence of combustion or in fires, such as metals like arsenic or lead, etc. So we routinely measure the PM 2.5 and the PM 10 fraction. So those solid and liquid metals show up in the mass of PM 2.5 and PM 10. So we measure that total mass all throughout the region. So there's a map on the upper right side of the screen. Red shows our regulatory official monitors that measure PM 2.5. And then we also incorporate a wide variety of monitoring data from low-cost sensors called Purple Airs and sort of a medium-cost sensor called Clarity that do a reasonably good job of measuring PM 2.5 throughout the region. You can see in the LA region, especially in the areas around the Eaton and Palisades fire, we have very, very good monitoring coverage for PM 2.5. So that takes care of the microscopic small particles. We also are concerned about larger particles like ash that are too large to be detected by air quality instrumentation, but are formed in fires. This can continue to be an issue. So I have a satellite image on the bottom right. So this image was taken in November, and the red circle shows an ash plume that's actually blowing off the Santa Ana Mountains. So this is from the burn scar from the airport fire, which burned not nearly as many structures as the Eaton and Palisades fire, but there were heavy winds blowing over the Santa Anas, and it lofted all that ash into the air. We continue to see ash being transported by fires throughout our region on the highest wind days. We also are concerned about some gaseous air pollutants. So it turns out that when you have combustion, you can form a wide variety of gaseous air toxics. Many of them do have odors, and they kind of all come together in a package. If we go to the next slide, please. So this leads to why we recommend precautions when any of the following conditions are present. So if there is high AQI, we recommend that you take precautions. If you smell smoke, which could indicate the presence of a lot of these gaseous VOCs, or if you see ash in the air, you want to take precautions to avoid exposure. Next slide, please. Okay, so getting more specific information on exactly what chemicals are in the particles or in the gas phase can also be very important. So we want to get this specific air toxics information to allow us to quantify the health risk. So we can provide precautions from PM 2.5 levels, from smell, from visible ash in the air. But in order to determine what the health impacts are or health risks of being exposed to different air toxics, we really need to quantify what particular air toxics are present in the air, what chemicals are present in the air. Also, air toxics data is very useful for source attribution. So just by measuring PM 2.5, it's difficult to determine where that PM 2.5 is coming from. There's plenty of just urban typical PM 2.5 in the atmosphere, especially in the winter months. If we know what particular compounds make up that PM 2.5, we can start separating out how much of it is coming from wildfire-related sources or fire-related sources, as opposed to just typical urban combustion. And with that, I'd like to introduce Dr. Jason Lowe, who's the Deputy Executive Officer of the Monitoring and Analysis Division at South Coast AQMD.
Great. Thank you so much, Dr. Epstein, for the regional air quality overview. And I appreciate the opportunity to share this space with all of you in this webinar to discuss the available regional air toxics data and also to summarize the expanded air monitoring effort that is underway right now. Regarding regional air monitoring, South Coast AQMD operates an ongoing network of 35 air monitoring stations in the South Coast Basin, some of which were shown earlier in Scott's slides. Some of these sites measure lead and arsenic, and we have 2 stations that measure a full suite of metal and gaseous air toxics. These stations evaluate air that is away from sources and represents well-mixed air. The graph shows the results of lead and arsenic at 2 of our air monitoring sites, one near downtown Los Angeles in the light blue, and the other one in Compton in the dark blue. The graph shows the levels of those two metals were initially elevated on January 7th, above the range of typical values, which is shown with the gray shaded region. The next few data sets on January 13th, 19th, and 25th show that the values of those metals were within typical ranges. This highlights that the air toxics levels reflected in those regional measurements went back to typical levels within a few days and remainder of when the fires began. There is no perfect air monitoring device that can measure in real time in all pollutants and an accuracy and quality that health assessments can strongly rely on. Therefore, we must use different tools to evaluate different pollutants and based upon the purpose of air monitoring. For the purpose of the Regional Air Toxics Monitoring Network, data is obtained by collecting samples in the field that are brought back for laboratory analysis by using US EPA methods. These are the gold standard for air toxics measurements. So these have the highest level of certainty, but do take some time for finalizing and displaying results, which is why you also see a gap in the days, because those represent samples that were collected on those specific days. Next slide, please. Other air monitoring data is also being collected as part of ongoing community air monitoring projects and use research grade methods, which are good measurements that produce data in near real time. Presented here on the graph is lead data measured at one of our sites in Huntington Park and similarly shows that the elevated levels of lead observed at the beginning of the days of the fires were elevated. However, the levels of lead returned to normal after a few days, which is consistent with our regional air monitoring station data. Next slide, please. Although it's great to have all this data regionally and also in other communities, it is important to evaluate the air in communities that were more directly impacted by the wildfire. So thus, an expanded air monitoring effort began on January 31st. This initiative evaluates the air during cleanup activities, and this monitoring is supported by US EPA, as Harry had mentioned, and conducted in strong collaboration with the California Air Resources Board, and is continued working in tandem with others, local, state, and federal partners in the cleanup effort. This effort is to evaluate pollutants of concern at the community level as residents are turning back to the area and rebuilding. This effort is not specifically addressing a house-to-house basis, but is intended to represent the air quality in the overall neighborhood and will occur in 2 steps. Next slide, please. The first step is mobile monitoring of air toxics, as shown in the video in the graph. A total of 4 measurement surveys are planned using mobile platforms, 2 in the Eaton fire area and 2 in the Pacific Palisades fire area. These are measurements that consist of mobile platforms that are driving in the areas to do a survey of air toxic metals and VOCs. These measurements take a snapshot of these pollutants as they are driving by to identify potential pollutants that may have concerning elevated levels. Also, these results may help inform where we locate the temporary stationary air monitoring, which is step 2 of the expanded effort. Next slide, please. So up to a total of 5 air monitoring sites are being planned to deploy between the Eaton and Palisades fire areas. Placement of these sites are going to be based on the cleanup activity, where schools and residents are coming back to, meteorological data, and results from the mobile monitoring from step 1. These sites will have samplers that will collect samples for evaluating air toxic metals, including arsenic and lead, and also taking samples for asbestos analysis. These samples would be taken back to a laboratory for analysis, so it may take a little time after collection to have results available. In addition, continuous particulate matter, PM2.5 and PM10, for a general idea of fine particle and resuspended dust, respectively, levels will also be taken. Results will be posted to a website to be publicly accessible. Next slide, please. So we were able to publish our results on our website. It's listed there on the slide, aqmd.gov/LA wildfires last week. And the results from the first mobile survey in the Eaton area did show that elevated levels of air toxics, including metals such as lead and arsenic, and gaseous air toxics, including benzene, were not elevated. The levels were actually consistent with typical range observed on a typical day and were below national standards and state health-based thresholds. The map on the right side of the slide shows a route of the mobile platform. The color of the route shows the levels of the pollutant. In this case, the pollutant that's being shown is lead that was observed by the platform. And the top scale, purple, shows what the National Ambient Air Quality Standard level would be for exposure. Again, the value of the plume as a mobile platform drives by, and the map shows that level on their route. If the levels were elevated, the levels would be in the blue, green, or purple. But as you can see, the levels for lead are all yellow in the map, which is good news for this survey. Even though the main task was to look for air toxics, the platforms are capable of measuring other compounds not considered air toxics, but are also important. One such compound is methane. There were a handful of locations where elevated methane was detected and could potentially be related to natural gas. Even though methane is not an air toxic, we are working with agency partners, including SoCalGas and Public Health, for follow-up actions. Next slide, please. So our next steps include completing our mobile measurement surveys. In fact, our mobile measurements started in the Pacific Palisades area today, and we'll be looking to get those results on our website by next week. We also are working diligently with our CARB partners to deploy and also do some siting for the temporary air monitoring sites. And we'll continue to work with all of our agency partners with the air monitoring data and providing technical guidance where needed. Lastly, the data will continue to be posted on the aqmd.gov website that you see there. With that, back to Courtney.
Thanks, Dr. Lowe. We've also dropped in the chat the link folks can access to see the data and results from that monitoring work. So with that, I am very excited to introduce Dr. John Balmes. He's Professor of Medicine Emeritus, UC San Francisco, Professor of Environmental Health Sciences Emeritus, School of Public Health, UC Berkeley, and he's also the physician member of the California Air Resources Board. Dr. Balmes.
Thank you, Courtney. And it's a pleasure to be speaking about the public health impacts of all the wildfire smoke and post-fire ash that you've just heard about from US EPA and South Coast Air Quality Management District. So building on what they said, just to remind everyone that wildfire smoke is a complex mixture of carbon monoxide, particulate matter, organic chemicals, toxic substances. And wildland-urban interface, or WUI fires, like what occurred with the Eaton Fire in Altadena and the Pacific Palisades Fire, those fires involve burning buildings, cars, plastics, electronics, etc. So they're actually more toxic emissions than a straight forest fire. So you've already heard about particulate matter, and fine particulate matter as small as 2.5 microns or less. And that's about the size of a human hair in terms of its dimension, its width. They can make it down to the deepest parts of the lung. And the even smaller particles can cross the blood into the bloodstream and affect the heart and other organs. And as what I think has been mentioned, these particles can include toxic metals like lead and arsenic. Now, toxic compounds from WUI fires include hydrogen cyanide, high levels of metal, nasty organic compounds like polyaromatic hydrocarbons, and volatile organic compounds like benzene and formaldehyde. Next slide, please. So what do exposures to wildfire and WUI smoke do? As was been pointed out by Dr. Lowe, the exposures were only for a few days. And so we're talking about short-term exposures. And we know that these short-term exposures cause respiratory and cardiovascular effects. And basically, they cause exacerbations of pre-existing respiratory or cardiovascular disease, like exacerbations of asthma, exacerbations of other lung disease like chronic obstructive pulmonary disease, which is usually caused by smoking, has other causes. And then there's growing evidence of an increased risk for respiratory infections like pneumonia and bronchitis. So there are potentially many other effects in other organ systems, but respiratory and cardiovascular effects are the best known from the existing research. Next slide, please. So I was talking about short-term effects on the last slide. I get lots of questions, including from many folks down in LA, that what are the long-term effects of wildfire exposures? And unfortunately, this is where we don't have enough research because it's hard to study the long-term effects of a few days of exposure, even if the exposure is pretty high. So actually, what we know most about in terms of long-term effects from wildfire exposures is studies of wildland firefighters and structural firefighters who may be coming to help the wildland firefighters. So we know wildland firefighters get much more exposure than community folks because they're right there putting out the fire without adequate respiratory protection. Because unlike structural urban firefighters, they can't wear what's known as Scott air packs to breathe clean air during fighting fires. So across a fire season, so that means many fires, a lot of smoke. We know that wildland firefighters have a decrease in their lung function and increase in airway inflammation. So they may be at increased risk of cardiovascular mortality and lung cancer from what we know about their exposure, which is again cumulative over weeks and months for a single fire season, and over many years, career wildland firefighters can be exposed for years during fire seasons. We also know that career structural firefighters, even though they wear Scott air packs, as I mentioned, and breathe clean air while they're fighting fires, they're still at increased risk for certain cancers. Bottom line is we don't know very much about long-term effects of wildfire exposures, especially the wildland urban interface fires. So more research is needed before we can provide answers. Next slide, please. So who is most impacted by wildfire smoke and ash? Well, this slide shows that young children whose organs are still developing, seniors who may have pre-existing heart or lung conditions, people with asthma, especially kids with asthma, pregnant people, individuals who had higher exposures to smoke and ash than others, and then low-income and under-resourced communities of color may have greater exposure to wildfire smoke and ash because of their housing quality and maybe less resources for making their homes have clean air spaces. And of course, outdoor workers, construction workers, farm workers have more exposure. And then again, people that are unhoused also have greater exposure. Next slide, please. So there are multiple pathways of exposure. We've been talking about outdoor air pollution, and that's the focus of today's webinar. But smoke and ash can make it indoors from outdoors, and then indoor surfaces can be contaminated by airborne particles that may have toxic materials. Soil can be contaminated from ash residue, surface water, like in pools, and then runoff from contaminated soils, and even drinking water can be contaminated. So there's inhalation exposure, which is the main route of exposure, can swallow particles, and then there's dermal exposure, skin absorption. Next slide, please. And I will turn it over to Courtney to introduce Dr. Rangan.
Thanks, Dr. Baums. All right, Dr. Cyrus Rangan, California Department of Public Health, turn it over to you.
Thank you very much. I appreciate your time and glad everyone could attend. My name is Dr. Cyrus Rangan. I'm a medical toxicologist with California Department of Public Health. Let's go to the next slide. So I wanted to just reemphasize a point that Dr. Baums brought up about the wildland-urban interface. Along up and down California, we have a number of homes that are in this zone, which essentially means homes that are very, very close to vegetation. And this presents some unique challenges when it comes to the smoke and the debris that may result. So it's not just from wildfires and vegetation. We also have the contribution of chemicals and particles that may arise from homes as well. And that combines to create a unique soup of potentially toxic chemicals in both smoke and in debris. Next slide, please. Just wanted to alert you to a surveillance website here at the California Department of Public Health and our Climate Change and Health Unit. This is essentially a wildfire, smoke, and air pollution dashboard. And through this dashboard, we do a lot of surveillance of air pollution, not only during times of normal ambient everyday air quality, but also in times of wildfires. And we use dashboards like this to chart things like emergency department visits and other factors that may occur during wildfires. So we'll provide this link for you in the chat. Next slide, please. So I'd like to concentrate a little bit on ash and soot. Now, when we think about the ash and the soot that may have deposited after the fires have been extinguished, ash and soot contains a number of different compounds. And as I mentioned, that interface between the wildfires and urban fires creates a very interesting combination of products that may be found in ash and soot. So that can include charred wood, fine carbon dusts. As Dr. Lowe pointed out, there was lead that was elevated in the air monitors during the fire. So metal fragments and dust that include lead, but even arsenic and some other metals as well can be found in ash and soot. We have a lot of older housing here in Los Angeles as well. So asbestos is another factor to think about when we think about ash and soot after a fire. And then pesticides and household chemicals and other solvents may also contribute to ash and soot that may be found in and around your properties after the fire has been extinguished. Next slide, please. One question that we often get from the public and from public officials and from clinicians as well. Should I get the ash and soot tested? Should I know what's in that ash and soot so I know what I'm being exposed to? Well, there's a sort of a nuanced answer to that question. Testing of ash and soot can be done, and it could reveal the presence of any or all of the materials and compounds that I mentioned on the previous slide. But it should be understood that there are very, very few standards for the interpretation of the potential health risks that you may incur from exposure to that ash and soot. So you could test for 1, 2, or hundreds of different kinds of chemicals and substances, but the standards for interpretation are not really there. So the goal question should always be, would the results of such testing modify or alter the cleanup guidelines and recommendations that we put forth for cleaning up ash and soot around your property? And just like we often talk about in the field of medicine, when we're testing a patient, we often ask ourselves as clinicians, will this test or the result of this test change the treatment that I offer this patient or change the management of this patient's disease? The same kind of philosophy kind of applies here as well. In most situations, testing ash and soot probably is not going to change the treatment that we will employ, which is general deep cleaning recommendations to try to get rid of that ash and soot. So in general, testing ash and soot is probably not going to yield a lot of information for you that is going to change the cleanup measures that we recommend. Next slide, please. So how can I protect myself during cleanup? Another very common question that we get. You've heard a little bit about the Phase 1 and Phase 2 EPA and Army Corps of Engineering cleanup protocols that are going on, especially in those heavily damaged areas from the fires. But what about the subset of folks who are returning to non-damaged homes, but who may have homes and properties that have been impacted by ash and soot deposition? So these areas are not necessarily going to undergo those EPA rigorous protocols and Army Corps of Engineer protocols about cleanup, but you may be responsible for the ash and soot deposition that may be in and around your property. So if you're going to be cleaning that up, we definitely recommend that you wear the proper kind of respiratory masks, which would be an N95 or a P100 respirator mask. We definitely don't recommend using a wet cloth around your face or your mouth. Those generally are not very effective at shielding you from the potential stir-up of the particulate matter that may occur during cleaning. Definitely use gloves to protect your hands from ash and dust and dirt that prevents skin irritation and transfer to other surfaces and other people. And chemicals, of course, that may arise during the cleanup. Definitely wear long sleeve shirts and pants, closed toe shoes, safety goggles as well. This is all for your personal protection. And double bag clothes after you've completed a day's worth of cleaning, and wash those clothes thoroughly after use. Next slide, please. What about the risks of exposure to ash and soot? Well, as you can imagine, ash and soot can certainly increase your health risks, especially for those vulnerable populations that Dr. Baum's referred to: children, seniors, people with respiratory, heart, or immune issues. These are folks who may be especially sensitive to all the risks that are related to ash and soot exposure, but certainly anyone can be at risk. And the risk mostly comes from stirred up particulate matter, as Dr. Baums emphasized in his presentation. So we recommend that you open windows and doors and ventilate those indoor spaces after you return when the outdoor air quality has improved. And certainly after cleanup has taken place, do another round of ventilation after that debris has been cleaned up. If you're going to be using an air purifier or air cleaner, make sure that it is an air purifier that has a charcoal-based filter. And these filters generally are more effective at filtering out those fine particulate matters. And in addition to that, we recommend that if you can, clean out your air conditioning ducts and change those filters as frequently as you can, probably a little bit more than the manufacturer recommendations because of all of the dirt and dust that's flying around. And we recommend that those filters be a MERV 13 or better. Now, MERV 13 is a notation that's sometimes found on the packaging of these filters. Some filters may say MERV 13. Some of them have a designation that says FPR. And if it's FPR 10 or higher, or MERV 13 or higher, those are the kinds of filters we generally recommend to keep those particle counts under control in your indoor airspace. If available, use recirculation mode on any kind of air conditioning type equipment that you may have in your home. And keep cognizant that dry sweeping and dry vacuuming, if not done in a very careful manner, can actually spread ash and soot. So next slide, please. So when we think about sweeping and vacuuming, just keep a few things in mind. When you're sweeping, gently sweep surfaces to collect those larger materials, and use plastic trash bags to contain those materials and dispose of them. If you're going to be vacuuming, make sure you use HEPA filter vacuums to filter out those small particles on surfaces. Otherwise, you may simply distribute those smaller particles in and around your home. So make sure it has a HEPA filter. And then the gold standard about cleaning up ash and soot: wet wiping and wet mopping. And so this is one way that you can clean these surfaces as long as you're wearing the protective equipment that we talked about earlier. And that way you can contain the ash and the soot and the dust from those surfaces in the wet mops and wet wipes, and then dispose of them afterwards. Next slide, please. So here's another question that we often get from the public as well. People may take it upon themselves to clean their homes, or maybe even hire a professional service, and now their home is clean. But maybe their neighbors down the road still have ash and soot. Maybe they haven't come back to their homes yet, or they haven't gotten around to cleaning the ash and soot in their homes that are just down the street from you, or perhaps even your next door neighbor. What do you do in those situations? Well, in general, we recommend that if you have already taken it upon yourself to clean your own property, keep your doors and windows generally closed to reduce the entry of outdoor ash and soot or smoke that may be still lingering after a fire. And wash your hands, wash toys frequently, wash surfaces frequently. So don't just think that I have cleaned my surfaces, I've cleaned my home, therefore everything is fine. Well, those surfaces can get recontaminated with ash or soot from down the street in your neighbors' homes as they're doing their cleaning as well. Prevent your children and pets from playing in those outdoor areas near those areas that are heavily impacted, of course, by ash and soot. And certainly take off your own shoes and have your family members do the same before entering your home so you can avoid tracking dirt, ash, and dust from other areas in the street into your own home. And last but certainly not least, monitor your own health. Watch out for things like respiratory symptoms, eye, nose, throat irritation, skin irritation as well. These are the kinds of things that can result after exposure to ash and soot. And if these kinds of things are persistent, certainly seek the consultation of your healthcare provider. Thank you for your kind attention. I'll turn it back to our coordinator, Courtney. Thank you.
Thanks, Dr. Rangan, for that really those actionable things folks can do to protect themselves. With that, I'd like to introduce Bonnie Holmes-Jen. She's the chief of the Health and Exposure Assessment Branch at the California Air Resources Board. Bonnie.
So much, Courtney. The California Air Resources Board, CARB, has programs and resources to help people protect their health by creating clean air spaces in their homes. For example, CARB certifies air cleaning devices for compliance with ozone emission requirements and electrical safety. So you can look for the label pictured on the top right of this slide when you're shopping for an air cleaning device. And this certification is important because we don't want air cleaners to create air pollution hotspots in people's homes. We want to focus on getting those dust and particle emissions down in the homes. You can find a list of CARB certified air cleaners on our website, along with instructions on how to choose an air cleaner. Dr. Rangan mentioned some key tips in choosing devices, and here are a few more. It's important to select air cleaners appropriately sized for the space you are cleaning. Portable units are best for single rooms. Make sure to check the clean air delivery rate, or the CADR, before purchasing a device to make sure that it's adequate for your room size. The minimum clean air delivery rate should be at least 2/3 the size of the room. Air cleaners also should have high efficiency, or HEPA filtration. And next slide. If people don't have a central heating, air conditioning, or HVAC system, don't have air cleaners, or just need a low-cost option, you can make a do-it-yourself version of an air cleaner with simple materials. You can use a box fan, MERV 13 or higher efficiency air filters, and duct tape. CARB has instructional videos and detailed instructions. We have this on our Smoke Ready California webpage. I think that'll be in the chat. And here's some pictures on the slide of finished versions for 2 different models. Please note that filters can be rated as FPR, or filter performance rating 10 or 12, and these are equivalent to MERV 13 also. Next slide. CARB has developed an analysis of the Camp Fire in 2018. The Camp Fire was another large and destructive wildfire in the wildland-urban interface, or WUI. CARB analyzed particulate and toxic emissions from this wildfire and compared these to air quality data from 3 other large wildfires that burned mostly vegetation. The results taught us important lessons about the levels of toxic metals, including lead, that are released in structural fires, and how these emissions can travel long distances. In the Camp Fire, we measured toxic emissions traveling up to 150 miles away from the actual fire source. This analysis is available on our CARB website, and the results have led to additional research underway at CARB. Next slide. CARB has ongoing studies evaluating the health and emission impacts of wildfires, including studying complex mixtures of pollutants that are in wildfire smoke that we learned about today, and including looking at structural fires, such as those in the wildland-urban interface areas. We're also evaluating messaging approaches to explain health risks and to help people reduce exposures. We develop and fund new research projects every year through our research planning programs. As an example of ongoing research, we are examining the statewide and regional health impacts of smoke waves. These are repeated exposures to smoke over days or weeks of a wildfire. This type of prolonged, but still considered short-term exposure is more realistic to the kinds of fire exposures people are having today. And we're looking at multiple health outcomes from these smoke waves. We're looking at respiratory and cardiovascular health, strokes, preterm birth, and mental health outcomes linked to wildfire. We'll make results available to the public when the study is completed in the next year. Dr. Balmes mentioned the lack of research available on long-term effects. And we're also concerned about this and looking how we can fill this gap. We're analyzing emission rates and chemicals from burning structures to improve our ability to analyze air quality and health effects from wildfires. Finally, we are taking input from the public on research concepts to support improving our knowledge of wildfire health and air quality impacts. If you have ideas, please submit them to us. We're providing a link in the chat, and this link is to our research website and includes how to provide input on future research for our CARB programs. Thanks so much for your attention.
Thanks, Bonnie. Okay, last presenter, rounding us out. Happy to invite Amy McPherson. She's Public Information Officer at the California Air Resources Board. She's going to share with you guys some resources that are broader than just air quality, certainly some of that, but also just broader resources in response to the LA wildfires. Go ahead, Amy.
Thank you. So yeah, we've shared a lot of information with you guys tonight. So the idea here is to share a few resources with you that will help you make some decisions for yourself and your loved ones moving forward as the recovery process goes on. And as I go through these, we are going to be dropping links in the chat to all of them. So first, let's talk about Smoke Ready California. This is a web page and graphics that we originally designed to help people prepare for wildfire smoke or to protect themselves during a wildfire. But there's a lot of great information in here that's also helpful after the fires. So things like how to create a cleaner airspace within your home, how to wear an N95 mask properly so that they are the most effective, and information on those portable air cleaners that Bonnie mentioned, how to create DIY air cleaners, a link to CARB certified air cleaners, which just means they won't produce ozone in your house while they're filtering out particulate matter. So lots of great information there that is useful after a fire as well. Next slide. This is our California Clean Air Centers map. This is a collaboration between the Air Resources Board and the state's local air district. Clean air centers are pretty self-explanatory, but it's a safe place to go for people during periods of intense either wildfire smoke or other air pollution, poor air quality. So say you don't have air conditioning in your home, you don't have a portable air cleaner or a DIY air cleaner, and you feel like you need to get out of the air, any air pollution if the AQI is high, you can look for a clean air centers map or a clean air center on the map. That includes everything from location, contact information, address, operating hours, and you can go spend some time there. They're typically open to the public. Spaces like libraries, rec centers where they have room to accommodate people. And so that is a great resource as well if you're looking for a place to go. Next slide. California Smoke Spotter is CARB's mobile app. This is another tool designed to provide information for people during prescribed fires and wildfires, but also has a lot of great information useful during recovery. Some of that includes real-time AQI for particulate matter, a 72-hour AQI forecast, clean air center locations, so you can get them on the app or on the website I just shared, as well as the health information from our Smoke Ready campaign that I also just shared. This is also available in Spanish and it's free to download on the App Store or Google Play. So next slide. For resources on overall recovery efforts, you're probably familiar with both of these websites, but they're worth mentioning. For state resources, please visit ca.gov/LA fires. And for county and federal response resources, we recommend visiting the LA County the LA County Recovers website. Again, both links are going in the chat there. Next slide. And also wanted to share one more time the webpage where South Coast Air Quality Management District has begun updating It's on its air monitoring efforts, including some of those initial findings that Jason and Scott shared with us earlier. You can use the link here. It's being dropped in the chat, or the QR code there to get the latest information from them as those monitoring efforts move forward. Next slide. And as Courtney mentioned earlier, we have set up an email address where you can send questions about air quality. That's LA-FIRES, plural, air quality @arb.ca.gov. We will respond as soon as we can, but as you can imagine, things are very busy. There are a lot of questions, so we appreciate your patience if it does take us a minute to get back to you. And again, the English and Spanish recordings of tonight's webinar will both be posted on CARB's YouTube channel, hopefully tomorrow. Should not have a problem doing that. If you go to our homepage, arb.ca.gov, you'll find those links as soon as they're ready. So I will pass it back to Courtney. Thank you.
Thank you so much, Amy. And thank you to all of you who have joined us this evening, taking time out of your evening. We know it's been a lot of information tonight. And as mentioned before, we're going to make this available to you all tomorrow on our YouTube channel. And, while we do have a lot of information for you, we also recognize that there are gaps in what we know. And with that, we are committed to doing what we can to continue make sure you have the answers to your questions. So please do email us at the address provided. And again, thank you so much for joining us tonight.